I'm quite sick, so something happens. It happens. So the first thing we'll talk about is leukemia. Before I start, does anyone know what leukemia is? Cancer. So the thing we're going over is what is leukemia, the symptoms, the causes, the risk factors, and the types of leukemia that we have. So, what is leukemia? As someone just mentioned, it's a cancer. It's a form of blood cancer which happens in tissues in the bone marrow and the lymphatic system. The lymphatic system is basically the lymph, it's like the lymph tissue fluid. It just flows around your body. So leukemia, as you can guess, is very dangerous. It mostly involves white blood cells. So white blood cells are potent infection fighters. You'll learn this more in biology, A-level biology in year 12. But yeah, so they're potent infection fighters. They normally grow and divide in all three ways, so your body needs them. But for people who have leukemia, the bone marrow produces excessive amounts of white blood cells, and they're abnormal white blood cells. So they're being mutated wrong, and they're in your body, and that's very, very dangerous because they don't function in the way that they should be functioning, which is to go against pathogens or be infection fighters. So the symptoms of leukemia. The main symptoms that you find are basically having swollen lymph nodes, enlarged liver or spleen, and this one, tiny red spots on your skin. Those are the main two symptoms that people have, but these are also other symptoms you can have. So fever and chills, persistent fatigue, losing weight without trying, excessive sweating, and burn pain and tenderness. This mainly is because your lymph system or your lymphatic system is around every part of your body, so around your bones, everything. So you're going to get bone pain because the lymph system is excessively having white blood cells there. Next, we have the causes of leukemia. So in general, it's caused because there's mutations. As I mentioned before, there's mutations, so the white blood cells become abnormal white blood cells or excessive abnormal white blood cells. And that basically means that the genetic material, DNA, isn't right as it should be. So this is basic about DNA. It contains the instructions that tell a cell what to do. Normal DNA tells a cell to grow at a set rate or to die at a set time. In leukemia, the mutation tells the blood to continue growing and continue dividing. So they don't have a set time to die, and they don't have a set, structure. Also, the blood cell production becomes out of control. So over time, these cells can outgrow healthy cells or can crowd healthy blood cells in the bone marrow. So that means that there's fewer healthy white blood cells in your body. So there's fewer infection fighters in your body to help against infections or any type of disease that you get. Now, there's types of leukemia. There's two types. There is acute and there's chronic. Acute basically means that it happens quite fast over a small period of time, and then chronic is over a longer period of time. Taking that into consideration, the first one, acute lymphatic leukemia, is the most dangerous type of leukemia that there is because this happens over a short period of time and it happens mostly in young children, so you need to act quick on it. Then you have acute myelogenous leukemia, so this is another common type, but that's mostly in adults. Why this is the most dangerous is because it's in young children, so you need to quickly go against it. Whereas an adult one, it's not that. It is bad, obviously, but it's easier to treat. Chronic lymphatic leukemia, another one, which is, as I mentioned, chronic is over time, so you could have it in your adulthood, but you wouldn't notice it until it gets really, really bad. And then your treatment could be quite long as well, it could be over a period of time. Then you have chronic myelogenous leukemia, so it affects adults again. They have no symptoms for months or years before even entering the phase of leukemias because the cells will just grow rapidly and you wouldn't even know. And because it's chronic, so it will happen over a long period of time. You could have leukemia and you would not even know until it gets to a point where you need to be hospitalized and under care, because that's when they'll find out that you have leukemia. If it is chronic. Acute, you will know straight away because it will happen straight away. So the risk factors of leukemia or developing some type of leukemia is previous cancer treatment. That's the main one. So a lot of people get leukemia after having cancer treatment. It will just happen abnormally. Their body might just, go into shutdown and just produce abnormal amount of white blood cells. You also have genetic disorders. Some people are actually born with disorders such as Down syndrome, and that can increase the risk of leukemia. So exposure to certain chemicals. Benzene is the main chemical that can cause leukemia. So being exposed to a large amount of benzene can cause acute leukemia. You also have smoking. That's acute myogenic leukemia that can happen for that, and also family history, as I mentioned over here, genetic disorders, anything genetic. If anyone in your family had leukemia before, it can be passed down to children. And that's all for today. Thank you.